Let's talk about wound care. You always want to start by taking a look at the orders from the providers or wound care nurses. There should be an order for dressing changes with instructions for how frequently to change and what supplies to use. All right, let's gather our supplies. This wound is a deep wound without high amounts of drainage, so we want to keep the wound bed moist. This order is for saline-soaked gauze packing with an absorbent outer dressing. So we'll need a rolled gauze, an ABD pad. These are commonly used for a lot of wounds, tape, scissors, a 4x4 gauze, sterile saline or wound wash, cotton applicator, and a disposable ruler. Once you're ready, perform hand hygiene and apply clean gloves. We will start by taking off the old dressing, being careful not to peel the skin. If the gauze is stuck to a dry area, you can gently loosen it by moistening it with saline. You can clean the wound bed and around the wound, but be sure to not spread contents from the wound to the outer skin. You also need to be careful not to introduce anything from the skin into the wound due to the risk for infection. Either soak with a wound solution by putting moistened 4x4 gauzes in the wound bed or gently wipe the area with saline-soaked gauze. Try to remove any loose slough or biofilm, which is a thin layer covering the wound bed. Let me know if you want to see a part 2 about assessment.